I'm Dr. Rhonda Coyne. Welcome to this Dental Monitoring Academy video presentation. And today I want to talk about dynamic protocols. And what I mean by that is when we change our protocols, our products and our intervals during treatment to get the most out of dental monitoring for our patients. So our protocols are the template of the rule set for patient management, and they tell DM what to do, they tell the patient what to do, and they tell our staff what to do. So when we set up the patient in dental monitoring, you have to select your product and then the protocol and then also your scan interval. And often once these are established, we tend not to change them. Also, using the pause feature is a really valuable tool if the patient needs to delay scanning for a period of time. So you need photo monitoring for go live, because if you don't have it activated, the patient is not going to get their dynamic aligner change information. And the go live feature is indicated up under their photo on the patient's chart, and it tells you what aligner number they're up to out of their total aligner numbers. Now, if for some reason that you don't have the go live feature activated, but you need to know how many aligners they have, I suggest you record it in the patient notes, and you can count the number of scans they've had to work out what aligner number they're up to. That's how we used to do it before we had the numbers indicated on the patient's timeline. So you need 3D monitoring light or full if you want to see upper and lower occlusals, like in the picture shown here. But you can't have go live in the 3D monitoring light or full options. With 3D light, you can only scan once a month, and I use that for my retention monitoring protocols. So these are my protocols that I have, and I try to keep them fairly basic and fairly simple, yet flexible enough to cater for what we need to do. I have two different types of retention protocols for fixed and for removable retainers. I have two different types of aligner protocols, our traditional one for just normal aligner change, and one where we're not changing their aligners and they're just using on a settling protocol. And my braces protocol differ for patients that are in town and out of town. Also, if you're doing combination treatment, so braces and aligners, you need to have a combination protocol set up so that you're not confusing the system when they think it should be an aligner and there's actually braces in one of those arches. And setting up your scan frequency. So for me, for most patients, most of the time it's going to be a 7-day, so a weekly scan frequency. And for aligner patients, we might choose to do a follow-up scan at 3 days. But you can see you've got a whole range that you can choose from what you want it to do. Now, when our patients are set up in dental monitoring, and my dental assistant will know from the treatment plan what product, what protocol, and what scan frequency we're going to use. And then, as I said, we're going to look at how we want to change that. So making it dynamic means that we're changing the product, the protocol, or the scan interval during treatment, not just at the different phases of treatment, because your scan interval may well vary for your OBS or retainer patients. But there are specific circumstances where you might want to alter the protocols that you already have established. So for example, if you find a setup error, when you're just using settling, where the patient's not going to change their aligners. For surgery patients, it's a really useful tool to be really able to track their pre, during and post-operative phases of treatment. And you might want to change your protocol and your scan intervals if they're tracking well or poorly. So just a couple of quick tips before we get onto this. When you're changing a product or a protocol, you have to stop and start monitoring. So the patient will get a monitoring started message and be prompted to scan when you restart. Now that message you can't change, it comes from dental monitoring and it varies from braces to aligners. And the timing that you choose to do this is really important. If the patient is not in the practice when you do this, so you can explain it to them, you need to time this stop and start just before they're due to scan, because you do it after they've scanned and then they get another message to scan, you're just going to annoy the patient. For aligner patients particularly, you might want to edit the protocol and unselect the first scan message that says that aligners haven't been worn enough if you don't want them to stay on the same aligner when you change the protocol. But that will depend on your circumstances. And that would be, for example, a modification specific to the patient for that protocol, and just uncheck that box, which is about the first scan. If we want to change the product, we might move, for example, between photo and 3D monitoring. Now, I'm rarely going to do this during treatment for aligner patients, but sometimes I might want to do it on braces patients if I change my mind during treatment because I want to now see an upper and a lower occlusal view, and I'm not going to see that in photo monitoring, but I will in 3D. Remember, if you're using 3D monitoring, either light or full, you have to have an STL file submitted. And for some reason, sometimes I might not have an STL file ready at the start of treatment, so I simply can't do 3D monitoring for them. And again, when I turn Go Live on and off, I might do that for aligner patients when they're wearing their aligners and not changing them, because I don't want them to be told to change their aligners if I don't want them to change their aligners. And that's an important way to use that dynamic aligner change feature. So if I turn off Go Live, for example, when I'm settling, the patient's wearing the aligners and not changing, I have to stop monitoring, I'm going to restart, usually photo monitoring and without the Go Live feature. Now when you set that up in dental monitoring, you're going to scan right to the bottom of that drop-down menu and uncheck that or check that little box at the bottom, which will turn Go Live on or off. I may have them on the same protocol they've been on previously, but usually I'm going to change them to a settling protocol because the messaging is different to what they're going to get about their aligner changes. I may want to edit the scan frequency. If they're not changing their aligners, I might make it every fortnight, or I'm going to keep it the same as every week. And again, depending on what aligner they're up to, I might want to uncheck that first scan message. If it's a start of additional aligners, the first scan message might be appropriate. But if we're doing this and going to a settling protocol at the end of an existing set of aligners, I probably don't want that first scan message to go out when I change the protocol. So you have to think about the circumstances and the messaging that you're setting with the patient. So when I change a protocol, and this is when you're changing a whole global protocol, you have to reapply the new edited protocol to the patients that already have that protocol applied, because otherwise it's only going to apply to new patients that you start with your new edited protocol. And what that means, any modifications to a patient-specific protocol that you've made will be lost when you reapply a protocol. So if you've silenced a tooth or an event, or you've changed the scan interval, those things are lost when you when you reapply a protocol. So you need to record when you have patient-specific modifications to a protocol somewhere in their chart, so that if you reapply a protocol, you can then reapply your modifications to that patient. And I would suggest that you record them in the DM notes and in your practice management software. So if you want to know what patients are on what protocols, go into your protocol menu, select the protocol you want to look at, and there's a blue link at the top. When you clicked on the link, you'll see a list of all of the patients that are on that protocol. And the second tab over will give you the customizations. And if you select yes, then you can drill down your list to include the patients that have a patient-specific modification to their protocol, and then you know which of those you need to make sure that you know what those modifications or customizations are, and then when you reapply the protocol, you can reapply those modifications. This is a really potentially complex feature on how you modify your protocols, and if you're unsure, talk to your product specialist, because they'll give you some help with this in making sure you don't lose data if you reapply your protocols. The pause feature, and that's a little blue link at the top of the patient card, is really useful. And you might want to do this if a patient can't scan for a period of time. Some practices will use this while you're waiting for aligners to arrive. For me, I tend to stop and start monitoring, but that's up to you how you choose to use it. But if the patient can't scan for a period of time and they don't want to get bugged about why they're late, use the pause feature. It's a really, really valuable tool. Modifying your protocols and your product for patients that are having orthodontic surgery is a really powerful part of DM. So for the surgical phase, when they have a series of passive aligners that they're going to wear with buttons and elastics, they're only going to change the aligner if they break or they wear out. We don't want them to get messaging to change their aligners. And this is again really useful for remote patients. So in this situation, they're going to go from Go Live in the pre-surgical phase. They're not going to be on Go Live during the immediate post-surgical phase, and they're going to be on Go Live back when they're on their post-surgical phase. So I tend not to have them on 3D monitoring because of the limited opening during this phase. It's just on photo monitoring. I want to ensure they have small retractors because they've often got limited opening, and we don't want to be too stretchy if they've just had jaw surgery. The protocol will often be the same because they're not settling, but I need to be checking what we need to check. And sometimes I will edit the scan frequency depending on how closely I'm watching the bite and how comfortable the patient is. So often I'll reset the next scan interval when I check them as they're going through this immediate post-operative phase. So an interesting example of this is this particular patient here. So they are remote, they work out of town, surgery is going to happen in a different city to where I am, and the two arrows on the top are actually when she attended the practice. So she already had a whole lot of setup. We were just waiting for her to mature and then be ready for her surgery. So surgery was moved forward. So the first little phase there, we sent her aligners and she had to get to aligner 12 at that date in September in order for us to have her ready for surgery. So we've just gone 4-day scans and just pushed her through. So she had the aligner that she needed when I had to put the buttons on prior to surgery. So then we turn go live off. So now she's just still going to scan, and she'll scan when she's comfortable to scan post-operatively and she's had her surgery, and that's where those little dots are there. And then we saw her again about 8 weeks later, and then we also took her buttons off then and we rescanned for her additional aligners, which I then sent to her, so she hasn't come back into cans at all for us to see her then. And then you can see the arrow on the bottom there is actually where she didn't scan, and her monitoring was paused because she was actually on a holiday at that point in time. So this is a really useful tool for someone who's remote. It enabled us to be really flexible because I'm checking and modifying her elastics in that immediate post-operative phase, and we can get a really fabulous result for her with actually as few appointments in the practice and as efficiently as we possibly can. So when we also change the scan interval, so if the patients are not tracking well, sometimes I'll lengthen the scan interval. So this patient here on their additional set of aligners, I've just delayed it down from 7 to 10 days because they just weren't seeming to be as motivated as they were in the first set. But on the patient underneath it there, I've shortened this scan interval as they've obviously progressed really well through. So they've gone from 7 to 6 to 5, and I can see that by how close the dots get together. Modifying your scan interval is really useful. Being flexible and dynamic in how you use the products, the protocols, and how you change the scan interval means you can really get the most out of dental monitoring for both you and your patients. I hope you found this useful and enjoyed this Dental Monitoring Academy video presentation. I'm Dr. Rhonda Coyne, and thanks for watching.